The second segment of the Nightly News is brought to you by Labrie Credit Union. Labrie Credit Union. We are not a bank. We are better. Welcome back. CEO of Export St. Lucia, Ms. Sumita Daniel, has explained the cost and projected benefits of St. Lucia's participation in the Dubai Expo, which is scheduled to begin on October 1st, 2021. According to the Export St. Lucia boss, St. Lucia is only paying part of the participation cost.
Participating in an expo at that level is quite expensive for a country, and so it is well between $5 and $6 million in cost. However, St. Lucia, the government of St. Lucia is putting in a little under 1.5 million. The rest would be funded by Dubai. So for us, that is very important to note and to say that at the beginning, we already have tremendous cost savings going in. We would not have been able to participate fully if we were to have paid this amount ourselves. In terms of the team, every agency has a different mandate and a different objective. So for example, for Export St. Lucia, we will have somebody on the ground for the entire 6 months because we will be retailing St. Lucia products. So somebody has to be there to collect that money, which will go back directly to our manufacturers. So as that money is collected, it goes right back to our manufacturers directly, which is pretty good revenue for them in a market they've never been exposed to. CIP, SLTA, and Invest St. Lucia are going to determine what the exact manpower will be required. Many of these agencies may not require people on the ground throughout. We will have a core, a skeleton core, who will be there, but then we will have other supporting staff going during periods of the entire 6 months.
Honorable Philippe J. Pierre Tuesday addressed the first African Caribbean Summit. In his contribution, he indicated that his administration welcomes this platform to enhance cooperation between Africa and small island developing states in tackling crucial international challenges.
My administration also welcomes this ready platform for communication, cooperation, coordination between Africa and the Caribbean to share COVID-19 experiences and develop mechanisms to help reduce our common dependence on equal vaccine distribution. This is a stark living reminder of the inequalities of the system. Having to import 10 times more pharmaceuticals than we produce in the Caribbean, and our regional vaccination levels at only between 15 and 23%. We also support the recent initiative announced by PAO to create a platform to increase regional vaccine manufacturing and production. Unfortunately, we also share particularly vulnerability to the ravages of climate change. This means that inevitably, we are all invested in securing sustained global action to arrest and reverse this scourge. In this regard, close cooperation between small and developing states, African countries and other developing states was instrumental in securing the 2015 Paris Agreement and the 1.5 target for global temperature increase.
Mr. Pierre further highlighted that Africa and the Caribbean must find ways to collaborate outside the framework of existing international agreements.
Thus far, we have collaborated and strengthened our voices, having common positions on such fundamental issues as finance adaptation, loss and damage. In the area of finance, it is imperative that we speak with one voice under the operating entities or the financial mechanism. Division simply retards progress for both our regions, something we can ill afford in a process where we can only move forward with consensus. Our regions must also maximize possibilities for collaboration outside of international arrangements, exploring areas such as technology, capacity building, research exchanges, and formal education opportunities. There is so much that we can learn from each other. Already within the climate change context, the African Union's Agenda 2063 is consonant with CARICOM's agenda as you prioritize environmentally sustainable and climate-resilient economies and communities. We are aware that you have committed to act with a sense of urgency on climate change and the environment, with a focus on climate technology, women and youth, sustainable forest management, and climate-resilient agriculture, among others. As we forge ahead, the Caribbean community looks forward to deeper and more meaningful connections with the continent of Africa, working together in achieving the developmental aspirations of our nations and our people.
The Ministry of Health officials in the neighboring island of St. Vincent and the Grenadines have reported 5 cases of the Mu variant of COVID-19. These cases were noted over a 3-week period between the 19th of July and August 9th, 2021. According to a press statement released on Tuesday, all cases were detected within the community as contacts of other positive cases and from persons seeking health care. The first case of COVID-19 was reported in St. Vincent and the Grenadines in March 2020, and to date, 2,389 cases have been recorded. The total number of active cases in country is 65, with a total of 12 deaths. Mu is the 5th variant to be named by the World Health Organization. The Delta variant is causing great concern to health authorities throughout the Caribbean. In Trinidad and Tobago, the Health Ministry is implementing new measures to counter the spread as multiple cases of the deadly variant is being discovered in various parts of the island.
The Health Ministry clarified today that there were 2 fully vaccinated travelers who tested positive for the Delta variant after having gone home upon entry. They tested positive for the virus despite having their negative PCR tests, but the Health Ministry assures the patients and their contacts were isolated, quarantined and tested as soon as the positive result was received. But with the travelers having gone straight home, some social media users are questioning if there is a gap in our entry protocols that needs to be filled. This social media user even pointed out that everyone the travelers interacted with would be positive contacts. But according to former Health Minister Dr. Fuad Khan, it's not necessary.
You already have enough. Just continue going as you're going. At the end of the day, you cannot protect 100%. You have to face the facts that you are going to be affected sooner or later.
He says the only way to protect the country from importing the variant would be to shut the borders once again. He says adding additional layers of protection to the existing entry protocols is a slippery slope towards this measure. The Health Ministry's clarification came today after Principal Medical Officer of Institutions, Dr. Miriam Abdul-Richards, mistakenly indicated all the Delta cases were unvaccinated during yesterday's news conference. Dr. Avery Hines later acknowledged that there were in fact the fully vaccinated travelers infected. The Health Ministry's initial releases about the confirmation of the Delta variant in these travelers did not clearly state they were fully vaccinated. Rashad Khan, CNC3 News.
You're watching the Hot 7 Nightly News. Stay tuned. There's more news coming up after the break. The second segment of the Nightly News was brought to you by Labrie Credit Union. Labrie Credit Union. We are not a bank. We are better.